Suwen 45 says, the spleen primarily assists the stomach in mobilizing its Jinye. It is the most important, always treated in any fluid-related issue. The spleen transforms and transports. It controls the initial transformation and direction in all stages, ascending the pure and descending the impure. According to Suwen 21, the chi of the spleen emits an essence that joins the lung and takes the water pathway, which will eventually lead it downward to the bladder. This upward movement from the spleen to the lung is known as the ascent of the clouds, and it occurs through G, the diaphragm, which, as you know, is a structure that both unites and separates the middle and upper jiaos, filtering the pure liquids propelled by the spleen to reach the lung. When we discussed the Wuxing, the 5 agents, in this playlist, we saw that the spleen occupies a central geocentric position in internal physiology. The spleen, minister of granaries, is the food that dominates the undifferentiated. Together with the stomach, it has in the first place a supply function. As you know well, its pathology can manifest as heartburn, slow digestion, pasty diarrhea, or diarrhea after eating. In this case, spleen 9 may be an appropriate point. Jean-Marc Espy adds that the spleen can lead to fatigue, both physical and intellectual. Moreover, Nanjing 19 asserts, the spleen is a solitary organ that nevertheless irrigates the other 4. Let's remember here that hexagram number 2, Kun, translated as the earth, explain how it nourishes all beings without judgments or conditions. Just as at the bodily level the spleen, that organ associated with earth, is related to supplying our material needs, at the psychological level it is also responsible for nourishing, taking care, giving love. As the Zang that provides and distributes to the rest of the body, good faith and that sincere word that nourishes are also associated with it. If we think about the extraordinary meridians, these qualities are exemplified mainly in Renmai and Chongmai. But if we think at the level of the Zhangfu, the classical text tells us, heaven is pure, earth is calm. The exponent of the spleen would be the mother of the family, nurturing, caring, discreet, willing, reliable. These virtues indicate its possible pathology. In other words, anxiety, anguish, doubts, lack of internal peace, or lack of self-confidence can be part of its pathology, as well as lack of generosity, not sharing your wealth with others, selfishness, indifference to the needs of others. Because, of course, what does the spleen do? It gives unconditionally from the center and distributes. Therefore, when someone keeps everything and does not share, this is a deficiency pathology of the spleen. Due to its central position, its affiliation with the earth element, and its role as the maximum yin, Tai yin, great yin, its meridian is located at this energy level. In the book From Symbol to Clinical Practice, Jean-Marc Espy tells us that the spleen is in charge of the yang organs that manage our regions or territories. This territory incorporates any personal area: physical, professional, familial, social, emotional, intellectual, spiritual, etc. When there are disturbances at this level, in what is my territory, we have to think about the Fu organs, because they are in reality the earthly or materialization aspect of what their paired Zang organs aspects resonate. What do I need? My land, my territory. I'm aware that it seems like an inversion again, we encounter again inversion, where yin goes to yang and yang goes to yin. When Kesby states that the spleen is in charge of the organs, and the Fu organs manage our regions or territories, he refers to the gallbladder, stomach, large intestine, small intestine, and bladder. With different shades, nuances, all these Fu organs depend on the central function of the spleen, and also on the gallbladder, which sets them in motion, as someone states that all the organs come to make their decisions to the gallbladder. Elisabeth Rochat de Lavalette tells us, the spleen presents to the heart what it extracts from the wealth of food to nourish it with abundant and well-formed blood. Through this same movement, the spleen presents to the heart what it extracts from the realm of memory and what the heart outlines in thought. Those propositional ideas upon which, if held in consciousness, thought will work. Therefore, a patient suffering from spleen pathology is often someone intellectual and very reflective. They also tend to be talkative about their symptoms, verbalizing everything. Moreover, they're exhausted due to anxiety about their present, about their future, etc. This exhaustion leading to depression, a consequence of this excessive mental effort, may be attributed to an overstrain of the spleen. On the other hand, Bernard Roteroche, who passed away many years ago, used to say that a spleen deficiency causes a lack of mental clarity. So, when faced with patients with slow ideation or difficulty solving life problems, loaded with worries and obsessions, we have to consider this Zang. By extracting the clear from the turbid, the supernatant yin qi, which floats, is delivered to the spleen, that ascends it to the upper jiao, the stomach being the sea of foods contributing to nourishing the qi of the upper jiao, whose mu point is Rem 17, sea of qi. According to Suen 29, the spleen's Jinye pathology, which doesn't ascend to the upper jiao, manifests as a disturbance of muscles, flesh, and joints, which weaken day by day until becoming powerless. Guillaume suggests needling spleen 17 to favor this ascent of Jinye to the lung. Here we see a clear example of how a deficiency of qi in the upper jiao may originate from a disturbance in the middle jiao, in this case spleen and stomach. For instance, the ultimate cause of fatigue with exertional dyspnea, indicating a lung qi vacuity, could ultimately be found in a dysfunction of spleen-stomach. Therefore, it will be very necessary to conduct a thorough medical history and always establish diagnosis before treating any dysfunction. A priori, the points that act on the spleen Zang are its mu point, liver 13, and its shu point, bladder 20. Let's take a moment to analyze the first one. The point liver 13, Zhangmen, is not only the mu point of the spleen, but also the hui or gathering point of the Zang, the organs. Something that becomes crystal clear when we look at the central position of the spleen, geocentric, in the whooshing diagram. It is also a crossing point with the stomach and gallbladder meridians, illustrating well the link in the center of the territory of these three organs. Zhangmen is also a point belonging to Daimai and participates in the Jing Pie, distinct meridian, of the gallbladder and liver. The essential clinical manifestations of liver 13 are distributed between the head and the trunk. There are no symptoms in the lower extremities. At the upper part of the body, we find epilepsy, chronic headaches, a greyish or yellowish complexion, usually accompanying spleen qi deficiency, epistaxis and dry mouth or halitosis, a picture of heat. There are some symptoms in the shoulders, difficulty raising the shoulder, axillary adenopathies, and in the arm, as well as one hand warm and the other cold. This is interesting. And then stiffness of the spine and dorsal pain. We move to diaphragmatic area, which begins with hiccups and flank pains, with dyspnea and orthopnea, which prevents lying down. This can happen, as we have seen before, because the spleen qi does not raise to the upper jaw. We continue with the same picture, but expressed in other ways. Spasms of the chest muscles, chest pain, and fullness with dyspnea. Violent cough, bronchitis, abundant expectoration or pulmonary tuberculosis. Then there are palpitations and heart pain in the heart, the other organ of the center, which can also be affected. And a little lower, digestive clinical manifestations begin. Esophageal constriction, dysphagia, anorexia, no pleasure in eating, belching, vomiting, regurgitation, gastric tumor, and difficult digestion, although there can also be polyphagia. We go down a little more, and here we have splenomegaly, hypochondriac pain, cholecystitis, gallbladder stones, hepatitis, pancreatic insufficiency, and jaundice. It is extremely interesting to note the intimate link in the center of the territory between the spleen and gallbladder. And there continues to be umbilical or periumbilical clinical manifestations. Cannot stand having the waist or waistbands tight. Spasms of abdominal muscles. If we remember higher up the spasms of the chest muscles, we see that in the clinical manifestation of Zhangmen, there is constriction in the entire trunk. Let's continue. Meteorism, Borg-Borigmi fullness and abdominal distension, abdominal masses, and then some clear signs of deficiency. Thin children with distended abdomen, this is malnutrition, hernia in the child, intestinal worms. And then lower back pain, acute pain due to cold. Let's not forget the repercussions on the back of abdominal clinical manifestations. Stools can be lyentery, there may be diarrhea, constipation, liquid diarrhea, or diarrhea with undigested food. There is also urinary clinical manifestations. The entire Jinye Pathway is affected here. Polyuria, urine with white clouds, phosphaturia, or with red sediments. Uric acid, renal and vesical lithiasis, dysuria, urinary incontinence. And we finish with the localized clinical manifestations, metrorrhagia, leukorrhea, and rectal bleeding. At the general level, we find muscle spasms, cramps, and tendon muscle diseases. The person has little energy, there is asthenia, weakness of the forelimbs. Notice that we had found many symptoms of fullness and constriction in the chest, and here what we find is a void in the periphery, episodes of weakness in the limbs, abundant sweating, and hypersomnia. There may also be restlessness and heat, hot and yellow body, weight loss, in this case probably due to consumption, emaciation, chronic malaria, and finally edemas, so typical of spleen pathology. English authors tells us that liver 13, Zhangmen, dispels the liver and regulates qi, and eliminates liver and gallbladder fire and damp heat. They also say that it harmonizes the liver and spleen stomach, benefiting the hypochondria. They seem very focused on the location in the Jue Yin liver meridian of this point. On the other hand, Philippe Sionneau points out that it benefits the spleen stomach and transforms stagnation and accumulations, something that seems a bit closer to the clinical indications we have seen so far. Anglo-Saxon authors also say that it regulates the middle and lower jaw. Well, how do French-speaking authors approach it? Benny Casuto, in the French Review of Acupuncture 151, wrote that Zhangmen means gate of totality. I had translated it as gate of manifestations. Men means gate, according to Casuto, that which opens the totality of the world, of that which relates exterior and interior in an undefined whole that breathes. For his part, Paul Couderc says that liver 13's function is to release the yin of the trunk so it can manifest, especially at the level of the extremities. This aligns quite well with the clinical manifestations we have seen of constriction, compression, or blockage in the trunk, and, on the other hand, deficiency in the extremities. Jean-Marc Quespi says that as the mu point of the center, Zhangmen governs the spleen, earth and place of life, like the center of Ming Tang, to which the emperor returns in his ritual after having visited the four Orientals, or like the last portion of the 18 days of the 4 seasons that allows each seasonal qi to return to the center, where it can transform into the next season. Remember that in the Wu Yun, the 5 movements, the spleen had been placed in the center, but it is actually distributed with each seasonal change. Quespi also says that liver 13's pathology is the impossibility of returning to the center, the imperial place of transformations. According to him, its pathology is an earth that does not receive, does not transform, does not transport. The apparent consequence of this lack of centering is a blockage of qi in the center, which cannot be distributed. Therefore, there is fullness of solar yin and a void of yin in the corporal periphery. I take this opportunity to comment that lower back pain present in the clinical manifestations of this point was acute pain due to cold. Therefore, it is a fullness of yin. Quespi adds that we must also consider the possibility that Chongmai or Daimai may be the cause of the clinical manifestations of Zhangmen. Of course, let's not forget the relationship between the extraordinary vessels and the rest of the meridian network. And furthermore, liver 13 is a point on Daimai. On the other hand, since liver 13 controls the free circulation of yin in the trunk, I think that it makes a lot of sense, given that it belongs to a meridian, Zhuzhue Yin, which is at an energetic level with a hinge function between yin levels, precisely those which favor mobility inside. Also above we find headaches and signs of wind, which we can also attribute to yin that is not capable of reaching the upper part. Now, let's illustrate Zhangmen's image of Quespi with a clinical case published in From Symbol to Clinical Practice. It concerns a 43-year-old teacher who went to see him for a syndrome which had been progressing for 5 years, consisting of a feeling of a knot in the stomach, accompanied by a feeling of emptiness in the head, dizziness, nausea, weakness in the limbs, and tingling all over the body. All this remained moderate except on some occasions when the patient experienced acute crisis that left him exhausted. However, neither his arms nor his legs were cold, as Kespi points out. There were no other symptoms. This man could not tolerate being touched in the stomach or solar plexus. All this pointed to a blockage of qi in the center, with a deficiency in the periphery. It must have been a yin qi, since there was no signs to a deficiency of yang or shui blood. As for physical history, there was nothing more than acne in adolescence. On an emotional level, things changed. He had a very painful love disappointment at the age of 27. At 32, mourning for the death of his twin children, 6 months old. And at 39, the death of his father. At 40, a leiomyoma had to be removed from his stomach. His tongue was normal, and the proximal qi and distal kun pulses were deficient, suggesting a blockage in the center, which confirmed the symptoms. Kespi decided to puncture liver 13. After a worsening of 48 hours, the patient was fine for 7 days. At the next visit, 15 days later, Kespi repeated the same acupoint. This time the reaction was for 48 hours, with morbid thoughts and apathy. On the third visit, a month later, Kespi still repeated the same point, but adding spleen 8, the spleen Shi point, which unblocks the spleen meridian, to reinforce the effects of liver 13. The patient continued to improve. 2 months later, he no longer had crisis, and the underlying condition had practically disappeared. After 7 weeks, he felt a little unwell for 3 days, with a feeling of weakness in the limbs, and Kespi performed 2 more sessions, spaced every 3 months, which practically eliminated everything. And here it is interesting to see how this great acupuncturist Jean-Marc Kespi analyzes his view in the book. From my point of view, liver 13 governed the center, and just like the emperor, after traveling the 4 Orientals in the Mingtang, had to return to the center. The pathology of this point is the impossibility of the person to returning to their personal center. In his opinion, the leiomyoma of the stomach seemed to evidence this man's inability to return to his center. Everything had been falling apart for him. For Kespi, the failure of central qi to be distributed to the periphery was only the apparent consequence of the patient's decentering situation after all his traumas. In the French Acupuncture Journal 156, Patrick Boudin says that liver 13 is a point that distributes central yin to the periphery, as others have mentioned. But he adds that when it is said to be associated with the gallbladder, we had seen that it was a crossing point with gallbladder and stomach. According to him, it is not speaking about the physical connection of an energy channel, but refers to the association in the center of the body's territory of the qi of stomach, spleen, and gallbladder. The psychic symptoms we can find in Zhangmen, liver 13, are basically disturbances with cold and depression. Clearly, we are in a fullness of central yin, something that does not mobilize. There is also a tendency to be afraid and insomnia. Well, fear is a yin that does not ascend to the upper part, and insomnia could also report to the same mechanism. A yin blocked in the center does not reach the periphery, well, but it cannot reach the upper part, heart and brain. On the other hand, as it is extremely common in acupuncture points to find seemingly contradictory symptoms, there are also clinical indications of a tendency to become angry, acting like a madman. For his part, Juliet de Moran tells us that stimulating tonification, liver 13 tonifies the liver, the yin organs, the brain, the cerebellum, the bulb, and the spinal cord. He is giving reason to this yin does not rise above, right? At the same time, he says that its tonification dispels yang organs, surely referring to mobilizing the fu, thanks to which all digestive and thoracic mobilization blocked in the clinic of this acupoint would be favored. So, if I had to summarize the dynamics of liver 13, Zhangmen, I would say that it is a point where the Jue-Yin energy level converges, which circulates yin freely inside because it's the hinge of yin, but at the same time, being the mu point of the spleen, Zhangmen has representativeness of the center, in which this yin, if it does not circulate through it, cannot expand to the periphery and distribute, as the spleen does, all its assets. And it seems very beautiful to see how, when you analyze a point in depth, you end up having a very simple and clear idea of its dynamics, which can be drawn practically with a stroke, which explains the set of clinical indications that we have compiled for this point, in my case for decades, but then allows you to use it with criteria, feeling that you are understanding the essence. Because clinical indications are multiple, and if we don't know what a point is doing in depth, it is very difficult to hit by chance when using it. Because, in fact, many of the clinical indications we have found of this point are repeated in many others. The difference is to elucidate what is generating the specific clinic of the patient, who, fortunately for him, does not have all the symptoms of an acupoint, which, on the other hand, would surely facilitate its identification for us. And even though we have not delved into the analysis of the ideograms of liver 13 today, which is fascinating as well, when you reach this depth of understanding of an acupoint, you can feel solid and reliable when using it. You can try it alone, with criteria, and with the ethical tranquility that comes from knowing that this is a possibility for your patient. We will continue analyzing other points, and in my online seminars, I will do them meridian by meridian. I have a lot of work ahead. But in the end, I realize that learning the points in this way allows us to touch bottom. And in my case, it almost always saves you from having to try point associations. But even among this, if you do not know the individual dynamics of each of the points you are associating, you do not have criteria to choose from the multiple possible associations. In this clinical case, Gespi ends up associating 2 points. But he's very clear about why.